Thank you so much for joining us tonight on your Thursday night. My name is Mandy Shreve. I'm the Director of the Homeless Solutions Department for the City of Greeley. And tonight we've got program updates from two of our programs that you've probably already heard about, our Foundations team and our Outreach team. And then we have a new team, our Rapid Rehousing Team, that's going to be giving an update and a more thorough overview of what they've been doing. And then we're going to have some open discussion with you guys, get to know you better, and talk a little bit about homelessness. So excited to have you, and I will turn it over to Maria.
Hello, everyone, and welcome. My name is Maria Hernandez. I am the Foundation's program manager. We serve 60 households with permanent supportive vouchers. 56 of those vouchers or those households have maintained their housing in the last year. We don't have a single eviction in our program, which is great. Currently, our team is really focusing on helping the individuals, families that we work with integrate back into the community. Many of our participants are enrolled in many community programs like Ames Community College. They are working on getting their GEDs. Some of them have gotten their driver license back. Others are connected with the Frontier House, other community resources like the rec center, libraries, just a lot of community resources. 6 of our participants are in the process of transition, whether it's from moving to their house to another home, a rehab center, or even completing the voucher processes, because we have a new participant that is joining our program. What else? We do have various of our participants connected with the local workforce center, and they are working on getting a job and just, again, integrating back into the community. Many others are working on like volunteerism opportunities. And that's pretty much it for my team. Any questions?
How long has your team been participating in this?
So the Foundations team was the first program that started when the Homeless Solutions Department started. This was a year ago. I started this as a case manager. I started back in April, and from April to now, our program has been in full effect.
Okay. Where are you housing these people?
Everywhere from Evans, LaSalle, Greeley.
Buildings.
Buildings. Well,
Homes.
yep, mobile homes, apartments, houses. We have a large number of community landlords that work with our programs, and they are throughout the county.
So they're individually housed, not like any one.
Nope, from time to time we will have maybe 2 families in one apartment complex, but the idea is to have them decide where they want to be. I don't make the decision for them. They determine where they would like to be, and depending on what is on their, whether it's their background, for example, or poor credit history, that's how we determine. When they apply for housing, we'll figure out if they get approved or who wants to work with them, but we're all over the county.
Outside Greeley as well?
Mm-hmm. Like LaSalle, Evans. Recently we applied for a unit in Johnstown, so yeah.
Mm-hmm. Do you have a waiting list or a list of ones interested?
So unfortunately, we only have 60 vouchers, and we're not accepting any other applications, or we don't have any openings for, other participants. And the idea is to expand and eventually obtain more vouchers. Yeah.
And those that you put in, there was no donor limit, or?
Correct. So when we first started, so we have 60 vouchers. 30 of our vouchers came directly from our coordinated entry program, and they were determined by Medicaid that they were the highest utilizers of medical services or emergency services. So those first 30 individuals were given to us directly from the coordinated entry. The other 30 were individuals that were referred to us from community members like North Range Behavioral Health, Housing Navigation Center, the police department, just anywhere in the community.
Do you know when you'll have more vouchers available?
I don't, as of right now. I know that they are working on another, November 1st.
So we're going to be getting 20 more vouchers from the state of Colorado. Against the contract supposed to get us
October, after that, is that?
and so we will be taking those individuals to the fucking care entry system. And do you all understand what that term means?
No.
Yeah, I know it's government, right? So there's a Northern Colorado Continuum of Care, and they kind of oversee almost all of Colorado that license is being carried for housing. And so a lot you're going to get from Ann in a second, but a lot of what this team does is help meet people, like they're going out into the streets, they're meeting people that are homeless with the intent to get them on this housing legislation. Once you're on this list that's governed by HUD, you can then be matched with housing. It may be the voucher housing that Maria is talking about, it may be housing in a town you're at here for space using your Rapid Rehousing program, but it gives you a chance to be housed. There's the City of Greeley programming or other for region counties. So hopefully that makes sense. It's just a lot of government terminology. Yes.
Thank you.
Hi everyone, my name is Nhật Nguyen. I'm the outreach team's manager, and we've been in operation since about January, but our team hasn't really been fully staffed up until about April. So it's been about 4 or 5 months or so. But we have 10 team members on our team. We are out pretty much every day, so we're out 365 days a year. Monday to Friday, we are out from 7 a.m. to 8 p.m. And then on weekends and holidays, we'll be out from 9 a.m. to 7 p.m. What we're doing outside is we are trying to look for clients. Like Mandy said, we try to get them on the community entry by name list, so they could be on there, potentially get housing from that. We're helping people with documents, transportation, resources, and benefits. And I just want to give a few numbers today to let you all know what the team has been up to. So we have helped house 23 households so far with Rapid Rehousing that's run by Stacy and other resources around Greeley. And we do have 20 other households that are matched to housing resources. That means they're in line, they're working on applications to get the voucher, or they're looking for an apartment, getting help from us, other case managers, and Stacy's team with Rapid Rehousing Team. We have helped diverted 3 households out of Greeley to reunite with families, friends, or they have housing resources elsewhere that help them to be stable. We have so far enrolled, this is an old number as of today. We actually have 404 clients that have been enrolled in our outreach program on HMIS, and that's individual clients. We have given 126 rides to clients. That is to DMV to get ID, get their medical needs met, housing application fill out, and meet with housing case manager and such. And we have helped 52 clients to get their document ready, that's to get their ID, social security card, birth certificate, so that they could then work on housing. But that's what the outreach has been up to. Any questions?
So I'm wondering, if I encounter a homeless person, would you be the one that I say, hey, there's a possible client out of you?
Yeah, if they're not a danger to themselves or to the community at the moment, and they're not committing any kind of crime, we are happy to go out. My team will come out and meet with any clients, offer the resources that we can help with, and refer them to resources that we know of. We can't force anyone to move along, and we can't, we can't do anything that the police can. So, yes, we will offer resources, but it's limited on what we can do.
And once they come out of jail, once they were not, when you're categorical, once they come out of jail, that's when they're most vulnerable. That's when you have to take care of them.
Yeah, we would definitely go out and, again, offer what we can do. Unfortunately, housing resources is not always available. We will try to do what we can. And I think at the moment it's even harder because we don't have a shelter to take people to. I think it really does cry out for a 365-day shelter. And I know the city, Mandy and Juliana are working on getting that. So hopefully we will have a 365-day shelter, and that should help.
So once you identify somebody that's appropriate for the program that will eventually get a voucher in the housing, when you're making contact with them, like do you have the clause with them in a motel so you can keep working with them, or do you just go back out to find them, or do you it's all over how do you like we stay at related?
We can certainly help client apply for phones. At the moment, the funding that we have does require the client to match housing resources before we put them in. I know there might be some additional funds coming, but I'll let Juliana and Mandy speak to that. But yeah.
So once you find somebody, then you'll go back out
Yes.
and find them on the street. So yeah,
That's-
I'm sure it's
So do you, where we've seen as we travel through the city, there's small pockets of people asking for money. Are those the kind of people you look to help or seek them out?
Yes, we will. If we see someone who seems like they're vulnerable and needs our help, we will definitely stop and talk to them. Try to make sure that we offer any resources that we have. Thank you, everyone.
Hi everyone. My name is Stacy. I'm the Rapid Rehousing Team Manager. Our team was created in May of 2024. Currently we have 5 case managers. We have 1 case manager joining the team soon, and we have 1 housing specialist. The Rapid Rehousing Team is a grant-funded program providing short-term rental assistance and services. The goal is to help people obtain housing quickly within 30 days, increase self-sufficiency, and stay housed with a goal of housing 80 households across the next 2 years. The program will be receiving 20 housing vouchers to assign to program participants who will not be able to gain income and sustain housing without further program assistance. Currently, there are 40 households enrolled in the Rapid Rehousing program. 28 of these households have moved into apartments already and signed leases. We have 2 additional moves scheduled tomorrow. These are some of our participant demographics. We have, like I said, 40 households enrolled. Of those 40 households, 11 have children in the home. 4 of these are veterans. The youngest child in the home that we're working with is 1-year-old. The oldest person that we're working with and housed is over 80. Our referral sources primarily come from Coordinated Entry and the outreach team and other community providers. We've received 29 participant referrals from our outreach team, from Niet's team, 2 referrals from the foundation's team, Maria's team, 1 referral from Adult Protective Services, 2 referrals from other community partners, and 6 referrals from Coordinated Entry. Our participants are working with the case managers to secure affordable housing and other various resources and services to achieve their stability, independence, and general wellness. Participants are working towards gaining income to pay a portion of their rent initially and eventually pay full rent and be on their own. Participant contributions towards rent will be reevaluated quarterly. Case managers are assisting with achieving stability by doing transportation to various resources. We do home visits on a weekly basis, a minimum of once a week. Face-to-face contacts are meant to have a purpose and be intentional. Case managers also strive to get our participants reconnected with families, building healthy relationships and community connections. Some of the community partners that we've been teaming with for training and collaboration or providing joint case management include North Range Behavioral Health, Greeley School District, Squad 1, Northern Colorado Health Alliance, Greeley Police Department, Adult Protective Services, Child Protective Services, Probation, Parole, and the Housing Navigation Center. This is the contact information for our current team. We also have an on-call 24/7 crisis phone for our clients and landlords to reach us. Any questions? Yes, ma'am.
How much Are they paying $1
It depends on their income. If they have no income initially, they won't be paying anything. Once income is achieved, they start at 30% of their income, and then we reevaluate quarterly. So as they gain more income, we increase their contribution. So eventually the goal is that they're able to pay their full rent and they graduate from our program and can sustain their housing.
And the older people, they have pension, I'm assuming, there's policy pensions available.
Some of the folks we're working with do have pensions, some of them do not. Yeah. Any other questions?
So some of these entities that you listed there, as a retired educator from School District 6, what is the process that they go through? Do they make referrals to the team? Is that the connection?
Can I answer a little bit of that to you? Why did you get No, so I'm for Volunteers in America, and we do actually refer our veterans who aren't eligible for our program to the city of Greeley. So I can say yes. I don't know.
Yeah, so several of those agencies are able to make referrals to us. They also work with folks and get them enrolled on the list for coordinated entry referrals. The agencies I listed tonight are also teaming with us for joint home visits to help with care. The school district helped with getting our kids connected to the homeless program through D6 and also getting them enrolled and helping with services after apartments were found. So the agencies I listed are involved with us in various ways, but they do also make referrals.
And they're active, I'm assuming.
Yes. Any other questions?
Just out of curiosity, how long is Rapid Rehousing program for you guys? Like if someone never gets employed and you pay it 100%,
So
does that ever end?
we are also receiving vouchers. So as people are progressing through the program, if they're not able for various reasons to obtain income and pay that rent, we are assessing for vouchers and they can be assigned a permanent housing voucher.
Just out of curiosity, why do you guys not go through the CAP system for that? I guess.
We are taking referrals through CAPS also.
Okay, you guys could do both.
Yeah, so our grant is to house 80. The referral sources are split. So 40 through outreach and community partners and 40 through CAPS, our coordinated entry.
Are you at a point yet, doesn't sound like, but I don't know, where they're leaving because they've reached that point in their lives through help and resources that they're able now to handle it on their own? Are you at that point?
Our program is not yet. We just started in May of this year, so we're only a few months in. But that is our goal with our families we're working with. Yeah. Any others? All right, thank you guys.
So we've come to the last portion of our event. We would love to hear feedback from you guys, your thoughts and ideas, and kind of be able to integrate that into how we move forward. So we're going to do kind of a breakout session where our case managers will lead some small groups, and we can kind of just like clump together where you guys are sitting. So the case managers have a couple of questions, and if you guys are willing to give your feedback, we'd be very grateful.